Hi everyone, Dr. Shaun here. So today we're going to be going over some quick tips on how to improve your crown preps. So first and foremost, you need to know what type of crown you're prepping for. For example, this is going to dictate what type of burr you're going to use. For example, if you're doing a metal ceramic crown restoration, then we're going to need a chamfered margin. So we're going to be using a different type of burr versus a shoulder margin, which uses another type of burr. So basically, we really need to know what type of crown we're prepping for, first and foremost. So another thing is that we need to know that we have the correct burrs for our prepping. To make it easy on ourselves, if we really want to make sure we're using the correct burr, for example, if you're reducing a prep a certain amount of millimeters, 1 or 2 millimeters, then maybe it's better to use a burr that's 1 or 2 millimeters wide. Make it a little bit easier for yourself. But also we use different burrs at different stages. For example, I'll start off with the coarse burr, and then I'll go to a fine burr, smooth everything out. And also, again, we use different burrs for different margins. So now I'm going to go over what I do, my exact plan when I go ahead and prep a patient. So I need to make sure that the patient is anesthetized properly.
She's given me such a strong injection. I can't move my face. I can't even blink.
So if a patient is anesthetized properly, then we have the freedom of working and not worrying about the patient's going to feel anything. So obviously, the faster and more precisely we can work, okay? Now, we need to make sure the patient's also isolated properly. So for example, if you like to use the isolite or if you like to use cotton rolls, just make sure you have a clear view of the tooth you're working on, because once you have that, then it's easier to prep the tooth. Now, when I start my prepping of the tooth, I first do a rough cut. So with a rough cut, I use usually a coarse diamond, and I go ahead and just do a rough cut pretty quickly about of what type of crown prep I want. Then after that, I go ahead to a fine diamond and I sort of smooth and fine tune everything, okay? Now, again, depending on the margin, I will be using a round end burr if I'm gonna do a chamfered edge, and if I'm gonna do a shoulder, I'm gonna actually use a flat edge burr. So those are the two burrs I like to kind of use for my crown preps. And then after I finish the crown prep, my most important thing is I really go around the tooth with an explorer and I try to make sure all the surfaces, especially the margins, are nice and smooth. So when the final restoration is fabricated, it just slips onto the tooth nicely. But most importantly, just take your time, speed will come. I think my average time to prep my crowns is probably about 15 minutes max. So I'm pretty fast, but as long as you take your time and work on your technique, the speed will get there, and yeah, that's pretty much it. Basically, make sure you know your crown type, know your burrs, and have a plan of action. So you're very methodical and can kind of go from this burr to that burr and just kind of have a plan to make sure that the prep goes within plan. But yeah, if you have any questions, you can just let us know. Otherwise, I'll see you next week.